Friends, I'm Dr. Sanjay Pandey from the Kokilabein Dhirubhai Ambani Hospital, Department of Urology on the second floor. It's important to take awareness to the next level, and that's what this platform does. It's an attempt to speak up on truths and make you aware on subjects which are not too much in public domain. Let's talk about something called as female urinary issues. And this is quite missed out. Sadly, women's urinary issues are not talked about too much, and it's important for us to take this subject head on. For example, women who are young, women who are middle-aged, and women who are elderly have got urinary issues of multiple kinds. And many a times, sadly, it's all about reports and all about medications. But many a times, we actually don't go to the bottom of the problem. So if we continue to treat smoke and don't quench the fire, we continue to live with problems which continue to happen, and women are plagued, attempting to see their family doctors, their gynecologist, sometimes urologist, and many more doctors, and sometimes attempt to get messed up completely and live on diapers. So, friends, the first and the most common problem in female urinary issues is incontinence of urine. That subject called overactive bladder. The bladder is erratically overactive, grossly contracts, makes you run again and again. You can't control urine. You have got a gross frequency of urination day and night. You've got an urgency, which is a precipitancy kind of a picture where you can't defer or postpone urination. And finally, you've got urge incontinence. There's a sudden feeling of urination. By the time you reach the washroom, you leak urine. That means the bladder doesn't allow you to reach the washroom for multiple reasons. Either it contracts before you reach the washroom, or you are the one who is an elderly lady who has got a walking stick, who cannot move, who has got arthritis, who has got thyroid issues, and somehow cannot reach the washroom. And sadly, this is not a 1 day, 1 week, or a 1 month affair. It's an affair which goes on and on in women. So I think female urinary issues, which are so neglected of, the commonest is female urinary incontinence. It's time to wake up. And this wake up call is about making you wake up that are you living with incontinence or are you ready to leave incontinence? Are you a woman who leaks urine when you cough, run, jump, walk, or bend? Then that's not overactive bladder. That's something else. So if you give stress to your abdomen and pelvic floor and you leak urine, that means you cough, run, jump, bend, climb up the stairs and do some physical activity which puts a stress on the pelvic floor which can turn weaker in women by multiple childbirths or post-pregnancy or by menopause or by age-related changes or by various surgeries in the pelvis, a woman could leak urine out. And this leakage of urine is not overactive bladder. Out here, the bladder is not at fault. Out here, the pelvic floor is at fault, which has turned weak. And the pelvic floor is at fault. We need to identify which level of fault that is. So, friends, stress incontinence is not uncommon. Our mothers, our grandmothers, women in the society at very prime of life in the 20s to 60s could be suffering from it. But nobody speaks up. Everybody lives a life of agony. Agony, disgust, waiting for it to happen, don't know whom to speak to. I would go and speak to my gynecologist. I will speak to my family doctor. I will not tell home I'm wearing diapers. I'm leaking urine. I'm smelling of urine. And I can't get up, bend, run, jump, laugh, cough, or urine would leak out. And that is what happens to an Indian woman. I think it's important for us to take this subject, take a campaign forward, and look at save the bladder, save the incontinence, save the infection, give her the confidence and give her the right back on a woman who continues to leak around. It's a very important subject of stress incontinence. So that we are touching incontinence in female urinary issues today, let's concentrate for a few more minutes on this subject. Women who leak urine before they reach the washroom because of urgency, frequency, urge incontinence are overactive bladder. An overactive bladder is treatable medically. There are medicines which can slow down this bladder contraction powers. So bladder becomes more sane, not contracting erratically. You don't have to run, rush, wear diapers before you go to a school, before you go to college. If you are a teacher, you are a banker, you are a nurse, or you travel long distance from Vasai and Valsad all the way down to downtown Nariman Point, and you can't hold urine out. You have to wear diapers. You don't drink water. You're scared of public toilets because you have to go and pass urine there. It's not acceptable. And that's what a modern woman should be. And that's where this entire campaign of waking up women that they should not leak urine is important. And I probably look at public platforms where I should be able to speak on this. To women's club, to women's societies, where probably nobody speaks up, nobody ever looks at it, but half the crowd or half the respected audience could actually be wearing diapers around. So women suffer in agony. Men don't suffer from this disease. Take it for granted. Men don't suffer from stress incontinence. They may have overactive bladder because then the bladder is at fault and we can make the bladder sane by specific medications. And if refractory and not listening to medications too on a combination therapy, then we've got many things. We've got botulinum toxin, we have sacral neuromodulation, but the entire gamut is on the overactive bladder or the bladder which is erratically overactive. While on the stress incontinence, where a stress of pelvic floor as a result of, as I said, walking, running, jumping, laughing, coughing, or anything which puts the pelvic floor into consideration of stress, leaks urine, is another phenomena altogether. And that phenomena never ends. That phenomena is where you will have to look at a urologist involved in the subject. Female urology close to our heart at the Kokilabin Hospital, where we look at each woman should not leak urine, should not have got a urinary infection, should not have a urethral diverticulum pouring pus from the urinary passage, should not have sexual complaints of vaginismus or contractions of the vagina, not able to perform sexually, should not have all these issues which women are plagued with. And as urologists, our job is to look into female urology and help you out. So important that stress incontinence, which is treatable not medically, but obviously with a minimally invasive surgery, where what we do is we put a specific kind of a mid-urethral sling, mid-urethral tape, a tension-free tape, where your urine is flowing very well, and that excessive leakage of urine which is happening as a result of stress goes away completely. So why not make hay while sun shines? Why not live a prime of life without diapers, without being wet, without having infections around? And therefore, this is a wake-up call for all women in the city and the country. If you have got leakage of urine, then it's our job as urologists to identify what kind of leakage do you have. Do you have an overactive bladder? Do you have a stress incontinence? Do you have a pelvic floor dyssynergia? Do you have a pelvic floor weakness where stools and urine leak out? Do you have something called as vesico-vaginal fistula where urine leaks from the vagina? Or do you have a recto-vaginal fistula where urine leaks from the motion passage? It's our job to evaluate, identify, and take it forward. So why miss it out, friends? For all women folk who watch this today, it's important that this awareness drive goes to everybody in this country. All women need to know, and why all men need to know. They need to be responsible for all the women in their life, which could be their sisters, which could be their neighbors, which could be their wives, which could be their mothers and grandmothers, that women folk may suffer from this. And large subset, close to anything between 30 to 70% women in the prime of life or postmenopausal or elderly age group suffer with incontinence of urine for reasons best known and the reasons best described. And each of them is treatable completely. The problem is a woman never went to the right doctor in any small city, town, or in the metro and megapolis. It's important for us to wake up to this phenomenon. Let's not lead a life on diapers. Let's not lead a life of agony and disgust and infection and skin issues. Let's get dry. Let's lead a dry life where we are comfortable, where we are confident. And why should a woman not be living confident out of her urinary issues after having seen a urologist? It's important for us to pick up all these urinary issues, which includes, I said a urethral diverticulum, a urethral stricture, a urinary leakage from the vagina or the rectum, or leakage from the urinary passage because she cannot control as a result of overactive bladder, the bladder at fault, or the pelvic floor being weak and therefore cough, stress, incontinence. I've repeated this again just for sake of identifying that women folk suffer. And if anybody suffers, it's important for you to be an ambassador to help out those individuals by going to a urologist who does the subject. Being keen on taking the subject forward head on and helping as many women as we can at the Kokilaben Hospital. I, Dr. Sanjay Pandey, as head of Department of Urology, would sign off and make it forward that many, many women go to their urologists in their towns and cities and take it to the right and the highest possible level. All of you who come to Kokilaben Hospital, keen to help you out and take it to the next level, where female urinary incontinence is abolished. It's time to leave incontinence rather than living with incontinence, friends. Thank you very much.